A very, very good morning to all the participants in this podcast. Today, we are going to talk about the basics of quality and QMS, that is the quality management systems. And I'll be happy to answer if there are any questions or queries at the end of this webinar. So, as you can see, we'd like to begin with the definition of quality. The quality explicitly means meeting customer expectations. So, when we talk about certain expectations that are met when the customer requires them, so we are set to achieve quality, and it's just a broad spectrum example that quality is basically implying that the customer needs or the customer expectations are met or exceeded. Talking about the dimensions of quality, we should understand that quality comes with a certain bundle of reliability, safety, effectiveness, and customer satisfaction. So when we talk about the dimensions or the parts or the you can say the components on which the quality system is designed or is supposed to be implemented. So the quality system should be reliable. There should be a safety effect addressed to it. We should have its effectiveness measured, and end of the day, the customer should be satisfied. And of course, the importance of quality, as we know, that it builds trusts. There is a massive reduction in errors in all our regular work and functions. And finally, there is an improved outcome of the work that we do in the day-to-day cycle of functioning. So for any business, when we try to identify its core components, so there is a requirement of a quality management system that should be present so that we can always address the needs and the expectations of the customer at all times. So when we talk about quality management system, so basically it implies that there is a structured framework of processes, policies, and procedures that are going to ensure that the quality system is deployed and the functions that are supposed to be met are being evaluated or monitored at a regular interval. Talking about the consistency, so basically, of course, the quality management system ensures that whatever product or service is the end product or the end service that is supposed to be delivered is always consistent, and there is no you can say deviation, or there is no deflection from what the customer needs or the customer requirements are defined in the preliminary stages. Similarly, when we talk about the regulatory parameters, that is the statutory and the regulatory parameters, so obviously that implies that when the quality management system is in effect, so the regulatory parameters are met, the statutory guidelines are being followed, and the customer requirements are therefore addressed at all stages of production planning as well as the final derivation of the service that we provide. So now let's talk about the core principles that are based on the ISO 9001. The ISO 9001 is the guideline that is, you can say, published by the International Organization of Standardization. The current version is the version that is 2015. We are expecting an amendment soon. But as of now, we are using the ISO 9001 2015 version as the base document for quality management systems and its effectiveness. So the core principles in quality management systems implies the following 7. So the first one being customer focus. So when the customer who is your maybe a patient in a hospital, or it could be a walk-in customer at a service station, or it could be kind of, you can say, an online customer. So the focus is always on the customer. That is the first principle. Moving forward, that is leadership. So when we talk about leadership, so leadership implies that whenever there is an organizational quorum of requirements and action has to be taken, so it is required that the people in the front lines or people in the, you can say, teams are showing leadership and governance at their core areas. Similarly, engagement of people implies that when we talk about an organization, it could be a hospital or a laboratory or a hotel. So the engagement of people is a must, because it should not be that we excluded a certain set of people and we implied that the quality systems are no longer prevalent for a certain sect or a certain batch of people in the organization, whereas the others, or you can say the larger sector, is identified under the gambit of quality. So engagement of people implies that the entire population or the entire you can say organizational team is included, and right from the grassroots worker till the top management, everybody has a core engagement to the processes and the functions of quality. Next, coming to process approach. So process approach, as we all know, that this derives inputs with certain activities or processes, and finally an output. So all these aspects are very clearly defined. They are documented. They are going to undergo a certain sector of training. And when we are very, very sure that all the aspects are very clearly identified, so we can definitely kind of vouch for the fact that the process approach, which is the core principle in the ISO 9001 guidelines, is met. Next, we come to the fifth principle, that is improvement. So definitely it is an ongoing process. It is never that we are able to, you can say, give a close-ended, you can say, answer to quality systems. It is always that whenever we talk about, you can say, one benchmark or one aspect of my work or service, it should always be measurable and therefore should leave a scope for improvement. And therefore, improvement is the fifth principle in the quality management systems. Next comes the evidence-based decision making, wherein all the decisions that are taken by the management, by the operations, by the, you can say, the teams that are responsible for quality function deployment. So there should be a sufficient backing of evidence. It should not be on moods or whimsicals or fancies. And it should never be that, kind of we are just taking decisions as per based on our feelings. So it should always be that there is an evidence which, kind of is gravitational enough to help us make those right decisions in our business. And finally, the seventh principle, we talk about relationship management. So relationship with all our clients. So who are our clients? This basically, we identify probably three clients in our normal day-to-day functioning of business. The first one being, of course, the walk-in customer. The second one being the employee, or the, you can say, the internal organizational, you can say, stakeholder. And finally, it is the government. So the government has a very important key function in ensuring that the business is ethical, the management principles are met, and we are delivering what we are supposed to do for the society at large. So coming to the benefits of quality management systems, if we see, the enhanced efficiency and reduced waste is the first benefit that we normally see in any deployed quality function. So it could be a manufacturing process, or it could be a production line, it could be a service industry, it could be an airliner, anything, wherever we see to it that a quality system has been, you can say, established, we have deployed a quality system. The first aspect that we easily are able to identify is that the efficiency is increased multiple fold, and there is a substantial reduction in waste, which is always, you can say, identified through its regular, you can say, consumption patterns. The second benefit is, of course, you have a better compliance. So it could be your statutory laws. If I talk about hospitals, it is about the biomedical waste management rules. If it is about pharmacy, so it could be like lesser errors in terms of the drug controller acts. If we talk about certain diagnostic centers, it could be AERB compliant. So you're always compliant at every stage when we talk about the benefits of a quality management system. Then coming to the number of errors, of course, when you have something which is being measured, you always have an obligation to have fewer errors, and eventually you're going to see that the number of errors once reduced, you are effectively going to see that there's going to be more savings, better compliance, as well as you automatically feel that the systems are more efficient and you are anyways reducing on the wastages that you are previously doing in your previous work cycles. And the third benefit is obviously customer satisfaction, because previously you were not monitoring customer satisfaction, but now that you're monitoring, you will identify that the customer who is your main, you can say, business giver is going to be satisfied at the end of the day. And that is a major confidence booster in any business that we imply. And finally, we talk about structured quality improvement. That is structured improvement when we talk about processes, we talk about systems. So eventually, whenever we see to it that a quality system has been established, so like in healthcare, I could give an example of the NABL guidelines, which are there for the laboratories. So once we have implemented ISO 15189, so we find that the structures and the systems that were previously absent are now being monitored and being measured, so that eventually leads to continuous improvement in the processes under which those parameters or those, you can say, reports are being generated. So definitely there is a structure, there's a improvement which you can very clearly measure in the day-to-day activities. A few examples which my team would like to share with you is about kind of how we have made very massive improvements in the quality improvement systems, as well as ensured that the hospitals, as well as labs and pharmacies, have ensured in their own core processes that those benefits were reaped and they were able to demonstrate a very substantial compliance to the ISO 9001 guidelines, be it NABH or NABL guidelines. So some of the few guideline examples that I would like to share, like if I have to talk about healthcare. So in healthcare, once we have deployed a quality management system in a hospital, you will find that the registration and the documentation process becomes standardized. That implies that once these processes are standardized, there is automatically a very major, you can say, improvement in terms of data collection, in terms of data interpretation, as well as the outcomes on which the patient is going to be given the treatment or its care plan. Same way, when you talk about a pharmacy, we find that when a quality system, maybe an ISO 9001 standard or maybe kind of a simple NABH guideline for pharmacy has been implemented, we find that there is a regular check on the drugs, their expiry, their storage conditions, and eventually that leads to the better efficacy of the drugs as well as reduced wastages in terms of its life cycle when the drug is inside the hospital or the pharmacy for use. And finally, when we come to talk about the diagnostic centers, diagnostic labs, we find that definitely when a quality system like an ISO 9000 system or maybe kind of an ISO 15189 system is deployed in such areas, we find that all the equipment that is mentioned inside the laboratory scope has to undergo a regular calibration. The SOPs have to be updated. The you can say the traceability has to be established, and you eventually find that all the IQC, that is the internal quality control, as well as the external quality control systems that are being in place, that eventually leads to a very, very accurate result when it comes to the diagnostic lab's output. So with that, I would like to open the ground for questions. And if there is any questions, I would request the panel to open the ground for questions so that we can answer the same and move forward. And once again, I thank my panel and my team for this opportunity given by me to present in today's webinar. Thank you so much.